Welcome to the RCI GDAS webinar titled Substance Abuse Among the Older Adult Population. It is presented today by Donna Plummer from the Pastoral Institute in Columbus, Georgia. Before we get started, let's cover a few conference details. If you have a question during the conference, we ask that you type in the question. All questions will be answered at the end of the conference. Also, if you are at your own computer station, a post-test survey will pop up at the end of the webinar. There will be 10 questions about the webinar and some personal questions such as your name and email address that will enable me to send you your certificate. If you are not at your own computer, copy down the link that is posted on the last slide of this presentation. Use the link at your own computer to complete the post-test. Certificates will be sent within 1 week after closing of the test. Please complete the test before June 17th to receive your certificate. We are now ready to begin. I want to welcome Donna.
Well, thank you so much, Elaine. I'm very happy to be here, and I hope everyone's having a great Friday. I'm going to go ahead and just jump right in.
Yes, ma'am.
Here we go. We're looking at substance abuse in the elderly, and as you can see under the title, we're looking at numbers of people who will triple by 2020. So this is definitely going to be a significant issue for the United States in the next decade or more. Just to show you some more numbers here, if you're looking at the baby boomer generation, that's folks born between 1946 and 64, and all of us are starting to age and hit that retirement point. And you can see for the next 19 years how many Americans are going to be turning 65 or older. And just to give you an idea of how big this generation is in the United States population, overall in the U.S. there's about 314 million persons. 72 million of those are baby boomers. So this generation has had a huge impact on American culture and life ever since they were born, and will continue to have that kind of impact moving forward. Now, the nickname Silver Tsunami comes from the kind of concern and anxiety about how this huge generation is going to impact our healthcare system. Well, everybody remembers the tsunami from like the Pacific coast when it swept into Thailand and had waves 10, 12 stories high. This is kind of the impact that folks are concerned may occur. And if you look at the numbers of seniors who may have a mental health or a substance abuse problem, again, we're talking significant numbers here. If we have 72 million baby boomers and 1 in 5 may have a problem, we're talking about a lot of folks. Here again, you're seeing some of the statistics that are being looked at. Several of the baby boomers have used illicit drugs early in life, and then they may have stopped when they entered their careers, raised families, and so forth. And the concern is what happens when they retire, and will they go back to drug use or alcohol use? And if you remember, this generation came of age in a time when drugs really entered the American culture. Hopefully these pictures bring back some memories of those for y'all who are part of the baby boomer generation. It's also important to remember not only did we have kind of the hippies or the peace and love folks, but we also had a significant group of Vietnam veterans, because the Vietnam War was going between 1961 and 1973, And a lot of those soldiers were exposed to alcohol and drugs in significant numbers, and many came back addicted to hard drugs. And let's look at a little bit of why baby boomers are at risk. One of them is just having grown up with recreational drugs. You know, very few folks really have fears about, you know, marijuana, or, you know, they're familiar with drugs. Doesn't mean they use them, but they are familiar with them, and that creates more likelihood to use. I had a relative recently who's retired teacher, been retired a couple of years, and asked me if I wanted to smoke a joint. It's just because he's in a different lifestyle now. He can do whatever he wanted, and to him, using marijuana occasionally was not an issue. And we may see more people with those kind of attitudes once they hit retirement and they don't have to worry about jobs. Kids are grown. They have a lot of personal freedom to do what they want. You can also see some of the other factors. We're in a difficult economy, which can lead to more stress, more depression, more anxiety, and people may be more likely to use or self-medicate with drugs and alcohol. As people retire, they often become more isolated. They're not around people during the day. They may have not prepared for retirement, may not know what to do with their time, may not be linked in with many social groups. You just also have the psychological aspects of aging, in the sense that most people do not look forward to this, with all the aches and pains and health issues that may come. The loss of loved ones as people grow older, and just a general decrease in physical health that can occur. Watching for major life transitions is an important factor for clinicians or other people, you know, medical practitioners to watch, because when people hit major life transitions, they're a little more prone to the mental health issues, and they may cope with the stress of a life change in negative ways. As you can see, other addictive behaviors such as hoarding or gambling may occur, which people would need to watch for. Okay, let's look at the major chemicals being abused. As you can recognize from the pictures, we have alcohol, which has been a steady favorite in the United States for decades, as well as marijuana, and then prescription pills. And prescription pill abuse has been on the rise for all segments of the population for the last 10 years. You know, we hear a lot more stories about the pain pills being abused, the stimulants with Adderall, Ritalin. These are all issues that are coming up in the substance abuse field, in the sense of what's out there and what people are using. And these are going to be the top chemicals that you would see seniors most likely to abuse. You can just see who's buying the prescription meds. And unfortunately, seniors are also the group that's often victimized the most by other relatives who steal their prescription pain pills and medications. Alcohol is very popular, and drinking can significantly escalate for seniors once they're retired. And again, they're not having to worry about getting up and going to work or, being mentally alert or able to concentrate. They have all the time in the world. Binge drinking is important to screen for, because as people get older, again, their body's not able to handle alcohol as well, and it becomes a serious health issue. As well as when you think of mixing alcohol and prescription pills, that can be extremely risky and lead to negative interaction effects or even, emergency room visits. When you look at marijuana, again, most people still think of marijuana as kind of a mild drug, in some ways even milder than alcohol. But many people are not aware that in the last 40 to 50 years, there's been a lot of experimentation with marijuana to try and make the THC levels get higher and higher. Back in the 60s, the THC in marijuana might have been at 0.4 to 1 or 2%, and now THC in marijuana may be 6% or higher. So the debate with pot is, at what point does the THC get so high in marijuana that we may be looking at a drug that moves out of what we think of as kind of the milder recreational category, if we can say that, to something that is much more serious and potentially more addictive. You can also see the numbers at the bottom of the slide, just that seniors abuse multiple different drugs. And again, whatever they may have used earlier in life may be the drug that they return to as they get older. Well, as everyone ages, we start having those aches and pains, and we may be asking for medication to help. I had a friend of mine who recently had surgery, told me that the pain pills didn't help at all, but a shot of Jack Daniels really knocked out her pain on that. So again, people who are familiar with different chemicals are likely to experiment to see what they like or what they prefer to self-medicate with. Now, it's very important to note the age-related changes in drug metabolism. As people's bodies get older in age, their body's going to have much more difficulty breaking down medications or breaking down alcohol or other drugs. On that, you'll find that elderly persons often require lower dosages of the psychotropic medications like antidepressants, just because their body has more difficulty breaking it down, and dosage levels that may be appropriate for someone in their 30s, 40s, and 50s may be inappropriate for someone who is 65, 70, or older. Again, it's important to watch for interaction effects between whatever the elderly person is using, whether it's over-the-counter meds, special dietary supplements, alcohol, prescription pills, whatever may be in their house. Here we're looking at how alcohol can impact on the body. I've had older folks tell me, I've always been a 6-beer can drinker person, and why is it, harmful to me now when I was able to handle that, for years and years. And it's because the body just can't handle the alcohol in the same way that it used to. And if they have other health issues, especially liver problems, then the body is going to break down alcohol at an even slower rate, which gives it lots of time to circulate in the body and aggravate other health issues. And you can see the number of health issues that are often associated with the impact of alcohol or high levels of alcohol. It also hits what we think of as kind of the mental health side by intensifying depression and anxiety symptoms. I hope you're starting to get a picture of how complicated it may be to sort out what may be going on with an elderly person if you see them confused or not alert. And, is it their medications? Are they mixing something with their medications? Are they depressed? There's a lot of factors here that as we get into the assessment area of this presentation, that have to be examined. Because baby boomers seem to be at such risk for developing addiction problems, they have named this late onset addiction. And so people who have not had prior problems all of a sudden in their older years are starting to present with significant either substance abuse or dependence issues. It seems to be hitting several segments of our population, whether it's women, African Americans, or Hispanics. I did a survey with one of the southeastern substance abuse treatment companies just to see what they're noticing, since they're dealing with people directly presenting for services. And it was very interesting to me to hear from them that they are already seeing presentation of more seniors and requests for treatment. And you can see with their numbers some of the jump, significant increase in people calling for help. Here are some of the warning signs that were chosen to be specific for older persons. The frequent falls, the unkempt appearance where they're not taking care of themselves. They may be staying in their pajamas all day. They're not grooming, they're not bathing. They're sleeping all day. Can't keep track of important items like keys, wallets, credit cards. And they seem to have kind of withdrawn, pulled away from family and friends. They're not interested in what were their previous activities. Now again, as you look at that list, we could think of many of those symptoms as being related to depression, over-medication, or maybe they're taking more pills accidentally from their doctor than they were supposed to. So again, it would be important to sort out exactly what is happening and what would be the cause for these kind of symptoms. This is when families and caregivers need to be particularly alert. Major life changes for an individual are often the precipitating event for abuse of chemicals. And we would want to see how our family member is coping if they lost their spouse, or if they were forcibly retired and no longer able to work, maybe due to health reasons, and they're not able to get out and do the activities they previously enjoyed. It becomes easy to get isolated at home and sit in a chair all day and watch TV. And TV is not particularly a positive, uplifting activity for persons. It can often be very depressing. All right, we're looking at one of the protocols that has been recommended by NIDA and actually SAMHSA, and it seems to be part of the protocols that are going to be implemented under the Affordable Care Act with healthcare reform. There is a push to really use SBIRT, as we kind of nickname it, as a way of screening for mental health and substance abuse issues that will allow us to intervene and treat possibly much quicker than waiting till someone is in serious straits and is maybe presenting through the emergency room in crisis with serious health issues at that point in time. And they're targeting alcohol, tobacco use, illicit drugs, and non-medical prescription drug use, which is just kind of a fancy way of saying that they're abusing their pills. The 5 A's of intervention here is nicknamed an assist method, and this was developed for medical settings. And this is training people to not be scared or shy or embarrassed to ask these questions of older folks as they present for medical care. So you're directly asking, I would very much like to just check and see how you're doing. I want to check and see if, there are any concerns around alcohol or use of tobacco or other drugs. And you just come at it gently and politely and try to do an assessment. And then as you're going through, if you are hearing information that indicates the person may be at risk for abuse or even dependence, you're going to try to see if they're willing to make a change and then link them for further assessment and treatment. Because what we're talking about here is a brief screening on that. So you might need a more in-depth assessment. which is exactly what I say on this slide. Screening is not a full assessment, and it's important to refer them if you have some serious concerns. In most substance abuse treatment programs in the communities will do in-depth screenings for free. You just have to refer the person to those agencies. Bradford Health Services is an example of one of those agencies, and then most people have one or more in their community, or at least within a 100-mile range. Here you see a list of some other brief screening instruments that can be done very quickly. This is to somewhat what you saw earlier, but there's a short and a longer version of that technique to use. Here you have the drug abuse screening test with 10 questions instead of the normal. I think it has like 25, let me see here real quick. Yeah, it has 28 questions normally. So modifying it down to 10 questions makes the test go significantly faster. And then the Michigan Alcoholism Screening Test, which is the MAST-G, has developed a geriatric version with a list of 24 questions, and an answer of yes on 5 or more questions would indicate probable alcohol problems. But it's nice to have a screening instrument there that's specifically designed for a geriatric population. Then you see the audit, which is very useful for minority clients. It seems to be a little more reliable for those populations. And it can be as simple as 10 questions. The CAGE is even quicker. It's 4 questions. One of them would be like, have you ever felt you should cut down on your drinking? Have people annoyed you by criticizing your drinking? And if you get yeses to these questions, then you might refer the person for a more in-depth assessment. The CRAFT is, again, another screening instrument you can use for both alcohol or drugs, and it is 6 questions. All of these instruments, as you can see, are available online. They're easy to download and then put in your own office to just use with clients. Or if you can remember the 4 CAGE questions, you could just do them in a verbal interview with someone. Okay, who are we looking at to try to intervene with this elderly population? And I think family and caregivers are probably the number one persons because they have the most contact. Now, as a person who has gone through being a caregiver in the last year and a half, I have also found that elderly persons don't necessarily listen to family members. However, they are more attentive to what their primary care physician may say. So it may be a situation where family have to become more involved in their elderly person's health care so that they can make the physician aware of maybe some of the signs and symptoms you're seeing in the home, but the person is not telling their doctor. And with HIPAA, you would have to be present to hear what the doctor is saying with your family member. They would have to sign a release if you were able to have ongoing conversations with the doctor. But also, if the elderly person refuses to let you talk to their doctor, I work with families all the time, and I remind them that HIPAA does not block a family member from calling a doctor and giving the doctor their information. The doctor cannot tell you anything in return, but it's very easy for a family member to call and say, I'd like to talk to the doctor or the nurse. I have some important health information on my father, mother, whoever the person may be, and have them notated in the chart so that the doctor is aware and informed and can take action. Other people that are important are folks who are in contact with elderly persons. So if you're working for the area agency on aging, van drivers, Medicare van drivers, people in senior citizen centers, staff there, or just pastors, friends, neighbors, emergency staff. Anyone who's going to come in contact with this elderly person can become a key individual in asking these screening questions and trying to get that elderly person hooked up with referral and care if indicated. Here we look at some of the barriers to treatment. Transportation can be big, being homebound, not able to be ambulatory. Elderly persons may have, less and less family and social support systems as they age. Treatment providers may not have the training to be able to link with this population very well. And there may also be the financial costs or just the budget limits, which may limit the number of people in mental health or substance abuse services which can be served. Here we're looking at some recommended treatment approaches for this population. Again, you're looking at possibly the brief interventions or home and community-based mental health and substance abuse outreach. We see again that one of the primary goals in healthcare reform is to integrate substance abuse, mental health, and primary medical care. We're looking at that cultural sensitivity here with a geriatric population. Generally, older adults in treatment do better when they can be grouped together. So they're talking to people of their generation who struggle with the same problems and issues. It's also very important to have that culture of respect. One of the older substance abuse treatment methods was confrontation. We have kind of moved more to the motivational interviewing technique, but confrontation does not work well at all with a geriatric population. You want to use a much softer, gentler approach when you're talking to them about whether they have alcohol or drug problems. You also want to be linking with their healthcare provider, making everyone aware who has a role in treatment of the elderly person aware of what's going on. It can also be important to include the spiritual concerns, because as people approach kind of that last phase in life, they may have big questions about death and dying, or what their purpose is. Why should I worry about whether I'm drinking or not? All I've got to look forward to is just dying and, I don't have anybody to take care of anymore. I'm not working. So it can be very important at times to explore those issues with a client. And again, keeping the treatment very individualized and flexible to meet that person's needs. You can see some of the key areas here in working with elderly clients. You want to work, of course, on abstinence, but you also want to work on helping them cope with some of the losses that are going to occur in this phase of life. So you want to improve their coping skills. You want to increase their social support system if at all possible. And you have to really pace the content and schedule of treatment appropriate to an older adult's style. And again, link with medical services so that everyone treating this elderly person are all aware of what the goals are. I wanted to show you a case study here where they actually tried to incorporate all these approaches to be more effective in both identifying senior citizens who had substance abuse issues as well as linking them with treatment. And so they devised this in-home program where they were actually trying to go out to homes as well as to other areas like the senior citizen centers and link with any program who might have contact with seniors and try to build this collaboration so they would be more effective. So you have the Area Agency on Aging, their county authority, and their psychological services clinic all coming together to do this project. So they started by training as many staff persons as possible on trying to identify seniors who may be showing symptoms of addiction problems. And they set up a simple referral system so they could expedite the process. Seniors didn't have to navigate a maze of computer menus on the phones or waiting for weeks and weeks in order to be seen. And again, this was a holistic approach to treatment involving a lot of the key persons who are interacting with seniors in this rural area. And you can see the folks, many of the people who were given training. And you can see how they were trying to do their outreach in multiple ways. And the agencies were all linked so that, the psychological services would know if someone, like the van driver taking them to the doctor's appointments, had concerns. All the information was shared so that they could be more effective in treatment. And what they found was that this worked. Through their collaboration and training of key persons in the elderly person's environment, they actually were able to identify between 3 to 7 persons who had needs per week and link them with treatment. Okay, we're winding down here. Here's some of the references and resources, the primary ones used in this presentation. You can see the TIP protocol number 26 is specifically on substance abuse issues in the elderly population. And then if you would like to see the SBIRT method demonstrated for you in a video, you can click that link and you can see it's about 5 or 6 minutes. And it's a very good presentation showing that process at work. Okay, we're on to questions.
Okay, at this time, if anyone has any questions, if you could type them in for us. I guess I have one comment. There's some days that I want to stay in my pajamas all day, but I promise you I don't drink. And when you said that, I was like, oh, my heavens, that's me. It's just from working so hard all week long.
Oh, yes, and I think what we're looking for is patterns.
Okay.
You know, not a one-off day, but, you know, a pattern of concern where you see the person doing some of those negative behaviors over and over.
Okay. And I do have another question, too. Can you tell us anything about alcohol-related dementia?
I don't know anything specifically about that, but, you know, again, alcohol as a substance does not do anything positive for the body. It will aggravate any other underlying health issue. So if a person has dementia or is starting to enter that phase, then alcohol is only going to aggravate it further. The same would be true for people, you know, if you have heart issues, like if you have congestive heart failure, or if you have severe high blood pressure, or you've had a stroke, or alcohol inflames tissue in the body, and then it starts to kill tissue with repeated use, so it can just make any health issue much more serious.
Okay. Well, I see Tanya has asked the question that we get every time, and the answer is the same, is that yes, this PowerPoint presentation will be on the Rosalind Carter website, and it's under the resource tab, and then you go to the GDAS link there. And I will, as soon as it's put on there, I will shoot an email out to everyone letting them know that it is online. I have slid over to the slide that will give you the link to the post-test. So if you're not sitting at your own desk, you might want to take this time to copy that down. And, of course, when we close out, this should pop up for you all. All right, we're waiting to see if there's any more questions. Okay, well, Miss Donna, you did a great job and you covered a lot, and that's one of the things that we're looking for. I know a lot of the people, as they go out and do assessments, they may be looking for one thing, and it turns out that it could be something else, and that's what we're trying to learn here, all the different tools that we can use to, you know, appropriately assess someone and get them the help that they need. So everyone should look into some of those references that Ms. Donna gave and watch that video. And again, if you should miss that link on the video, come to our website and you can scroll through the slides to find that link, or I'll be glad to share it with you either way. So I guess we're going to close up. Everybody have a great weekend and a great summer.
Well, thank you.
Thanks, Ms. Donna.
All right.
Bye-bye.
Bye-bye.
Thank you. Please stand by.